Mr. Jenkins.
Pleasure to meet you.
Pleasure, Joseph Montgomery.
Alright, Joseph, can you tell me about yourself?
Yes, sir. Recently graduated from Shenandoah University. Nursing major. Really excited to start my career. I'm athletic. I play the drums. Like the outdoors. Yeah.
Okay. Why are you interested in our organization?
Really excited about what you guys are promoting, community health and, bettering the community in general, so.
What contribution will you make to our organization?
I think I can help in being a leader, providing an excellent support as a team member. I have, a lot of years of experience in team-related activities, ranging from sports to, being a mechanic, working in a team environment at an auto shop, bartending, working at a restaurant. You always have to have each other's backs, so having experience in those types of fields, I feel like I'm prepared to help your organization.
Okay. Can you tell me what your strengths and weaknesses are?
Yeah. I'm a leader. I like to take charge. I don't like to sit around and wait to get things done. Something needs to be done, I do it. Great work ethic. If you need me here 6 in the morning to 6 at night or however long, you call me, I'll be there no matter what. Some of the weaknesses, being a leader sort of leaves me a little hard-headed. I feel like I don't take constructive criticism that well. Even though it is for my better, I just feel like sometimes I look at it as the opposite, like I'm doing something wrong, so.
Can you tell me what your most significant accomplishment is?
Probably making it through nursing school and not knocking up a girl in my teens. So, yeah.
Alright. What kind of compensation are you looking for?
Well, I feel like my knowledge and experience getting a bachelor's degree in nursing, I feel like, whatever you offer should suffice. I'm just looking to start a general career in nursing, whether it be 40,000 to 60,000, it doesn't really matter. I'm just looking to get my foot in the door, gain some experience, and learn and look for an opportunity to rise in ranking. So,
Can you describe a stressful clinical situation and how you handled it?
yes, I can. Patient was post-op from CABG surgery, 6 days on a vent, and that day she was scheduled to have an arterial line put in, and after numerous attempts of a radial attempt, an axillary attempt, a femoral attempt, a brachial attempt, they finally got one in, but it left the patient working over the vent, and she had recently been cardioverted 2 days prior to get out of AFib, and after those arterial line attempts, she went back into AFib and started trying to breathe over the vent and was not synchronized, and her blood pressure started to drop. It could have been from a lack of blood that she experienced due to all the A-line attempts. Regardless, BP started dropping, and after that, the cardiologist and 5 other attending physicians came in the room, took over, and taking blood gases every 5 minutes. The nurse was hanging pressors and pushing bicarb, and I was helping out as best I could with whatever the nurse needed or whatever the doctors told me to do, I did, and she came back. They cardioverted her twice, and pressure rose, and she's stable. So,
Can you describe an encounter with an angry or frustrated patient and family member and how you handled it?
yes, one of my first semesters in nursing school, I was dealing with a dementia patient for my fundamentals clinical, and he didn't know where he was, what he was doing, and he had defecated in his briefs. His family was in the room, and I was trying to change him, and he tore off his briefs and threw them at me, and it was not a good situation, but I calmly diffused it, told him everything was okay, and sit down, we'll take care of it. I looked at the family members, asked them to kindly leave the room while we got the situation under control, and diffused it. The family members understood everything, and that was that.
Okay. Is there anything you'd like to add and sum up before our interview is over?
Yeah, I would. First off, I really appreciate the opportunity of you meeting with me. What it means to be a nurse really hits home with me, and at the end of the day, I'm really looking for that gratification after working in various fields of construction to being an auto mechanic, and being raised by a single mother with no dad. My dad left when I was 5 years old. I'm really excited to get started on this new career, and I'm looking for that gratification at the end of the day. So I really look forward to hearing from you.
All right, that sounds great.
Pleasure, sir. Pleasure.